Friday. My name is Simone Leyden. I'm the CEO and co-founder of Neuroendocrine Cancer Australia, what was previously the Unicorn Foundation. And greetings to all our unicorns out there. I firstly would just like to acknowledge the land of which I'm beaming into, which is the native land of the Bunurong people here on the Mornington Peninsula, and I'd like to pay my respects to the elders past, present and emerging. And I am so grateful to be part of this incredible community that we have down here, but also, to live in this beautiful part of the world. And we hope that, soon enough after this Sunday, we may also know that we might be able to leave this also beautiful part of the world and move to beyond 5 kilometres here in Victoria. So I hope everyone is doing okay. Greetings to all our friends in other states as well. But I guess I just as a bit of an update from some things I was talking about last week in relation to border restrictions. We are still working very, very closely on trying to get access for our patients. I did mention last week we were dealing with our Tasmanian patients and getting access to Victoria. This is something that we're really still doing. We're also exploring whether these patients can also go to Queensland and get treatment there and what the implications are there. So please know that everything you're posting here, and I really, really appreciate you talking about, getting access to your scans, to your treatments, to any clinical trials, please keep sharing because we are absolutely reading them. And we are working behind the scenes with the doctors and with the health departments on ensuring that you all have ongoing access and consistency with your care as well, and that you're not put out too much. So I haven't seen what they've been talking about at the National Cabinet level about what they're going to do around these border controls, but I really hope that we start to see some common sense with regards to that very, very soon. So, look, other things that we've been working on, I know that, obviously Kate is on leave and she's enjoying her time. I purposely have not spoken to her, and she will be off until Wednesday, the 16th of September. But if you do have any concerns, we are absolutely here. Please email Meredith or myself. And we will absolutely answer any queries that you may have. We don't want you to feel that you need to wait, especially if it's really urgent. So please get in touch and know that we are working here and always available to you. So today I thought I would just talk to you about, following on from some of the things we spoke about last week on the cost of nets, and hello to everybody commenting there. Thank you so much for letting me know you're here and that I'm not talking to a screen by myself. But following on from, what we were talking about with the cost of nets, I wanted to let you know some of the things we are doing around earlier diagnosis. Obviously, for us, earlier diagnosis is absolutely key. We know that being able to diagnose patients earlier will improve outcomes long term. But we also, really understand that this is a cancer and tumours that can be around for a very, very long time, and because they're not usually recognised by our primary healthcare professionals, they are picked up when it's stage 4. So one of the key projects and what we're looking at doing to try and combat this is to really focus around education. Obviously awareness, and I'll talk to you about awareness, but education is really, really key, especially for our medical professionals. And not necessarily, we have an incredible community of neuroendocrine cancer specialists and multidisciplinary teams, and they do ongoing education. But what we want to get to is the the healthcare professionals outside of our neuroendocrine space, and try and educate them more on what to look out for and what scans to send or what diagnostics to refer patients to. So you may recall a while ago, and it does go back to, please know that whenever we ask you to do something for us, we absolutely use your feedback and your survey results to drive projects forward. So a little while ago, I think it was back in the start of 2019, start of last year, we asked you to nominate your GPs that treated you, obviously, to really try and find out from them what gaps in information that they had. What did they do when they were first, looking for a diagnosis, and to try and really get more information, real world information from our GPs to facilitate some sort of education program to improve their knowledge and ultimately improve the care for you. So from that, I think we had about 75 GPs that were nominated by you, and we sent out a survey. Interestingly, we tried to get a lot of the GPs to do that online, but we ended up having to send paper copies, and also faxes. Faxes are still a thing. And of those 75 GPs, we had about 34 responses, which was quite good, which was about 45% response rate. And we asked them all a variety of questions around the first diagnosis, and unsurprisingly, of the 74% of the GPs who responded, they had actually seen you as patients prior to your diagnosis, but only 5% of them had actually suspected a neuroendocrine tumor. So it is unsurprising, but also incredibly, shocking at the same time, of how much we need to improve that thought of, suspecting what are these common symptoms that they could potentially be a neuroendocrine tumor. They did mention that a lot of the key symptoms that you all mention as things that you have were presented in front of them, such as nausea, abdominal pain, flushing, and diarrhea. These were some of the key things that they obviously saw as the biggest one, with abdominal pain being the biggest, and also bloating. So they did obviously realize that they were symptoms that they, should be, but they didn't connect the dots with a neuroendocrine tumor. From that, we found that the GPs traditionally then referred you as patients for an ultrasound and a CT scan, which is fantastic. But the problem is, we are seeing that generally you would have presented to the GPs for, gosh, on average, very many years before you got to that stage. That's not everybody. Obviously, we do have some really great success stories where patients are picked up earlier and can be dealt with earlier. But then we also have patients that may have had very, very vague symptoms for years and years and years, but then these symptoms really become a lot more aggressive, and that's where that big timeline can occur. And so it is so variable. So we do absolutely understand that it is then harder to diagnose, but what we can really try and do is raise that awareness and education of what these, if you're presenting so many times, what to look out for. So interestingly, the GPs initially referred you to a gastroenterologist or a colorectal surgeon once the diagnosis was made. And what we are trying to educate there is really that the oncologist should be put further up there. So definitely before a colorectal surgeon, and potentially on par with the gastroenterologist. We would like the oncologist to be one of the first referrals there. so then that we can actually be, starting to put the patient pathway together. So from all this information that we had, and there was a variety of different information collected, we have been working, and I won't go into too much detail with the whole program, because I'd like to get Meredith, our project officer, to be talking about this in the next couple of weeks when we're going to launch it, because we will need your help in promoting it with the GPs. We have put together a 4-module online module education program that will be accredited by the Royal Academy of RAC, College of General Practitioners, RACGP, and it is actually a Category 1 education module that will accredit GPs who do the program with 40 what is called sort of CPD points, or 40 professional development points. We've done some really great creative around that, and I'd like to thank our 4 unicorns who were part of the videoing and telling their story, especially around diagnosis and ongoing treatment and all the different aspects of living with neuroendocrine tumours and neuroendocrine cancer. And I'd really like to thank them, and they know who they are, and we'll be promoting them very heavily. But we are putting this whole program around, not your usual suspects. So we really, really want GPs to, regardless if they've got a patient that they're currently working with, or whether they have just got a general interest in this field, we really want to get those ones that we want to get both. We want to get both segments of GPs, so that we can try and get the ones who have not necessarily been suspecting neuroendocrine tumours to know what to look out for, so that we can try and increase this earlier diagnosis, but also for the ones who are actually treating and working with you to be doing it to the ultimate level, and working with your multidisciplinary teams, and really encouraging the GPs to be part of this multidisciplinary share team with you, because we know that it's a long and an ongoing journey, and we want it to be as long as possible. And we want that GP to be part of, a partner in that as well. So we are looking to launch this definitely before World Neck Cancer Day on November 10. And we, as I mentioned, will be asking you to promote it within your own GPs. We'll be providing you with some promotional material to get everyone signed up and enlisting in that. And we really hope that through the promotion of fields outside of our neuroendocrine space, that we'll be able to get as much uptake with that as possible. So I just wanted to talk a bit about that, and as I mentioned, I'll get Meredith to really launch it with you. But education is multifaceted, and so obviously GPs are incredibly important. We've been talking with the Federal Health Department on adapting these modules that we're creating to nurses, and we're looking at trying to roll this out with the Cancer Nurses Society of Australia, which would be fantastic. And we're also looking at going that step all the way forward or backwards, and looking at trying to get these modules into tertiary education. So trying to get to those people who are studying medicine because we know that from the past it hasn't been part of the curriculum. It hasn't been enough. Many times we used to be told by people practicing medicine that carcinoid and was one tiny part of their booklet or their textbooks at the end of their course. So, we realise that this is something that we really need to really push forward in that, and especially when you're specialising to be oncologists. But even, second year university, third year university, prior to medical students actually even choosing where they want to specialise, to get them interested in neuroendocrine cancers and neuroendocrine tumours. And I think that will be a really big coup. And so we're working with the universities on what that looks like and how we can actually improve it there. One of the current things we're also doing is some in-services. So again, Meredith is a trained oncology nurse. We are so lucky here to have these wonderful, very smart and very knowledgeable oncology nurses working with us. And whilst Kate is the forward face for patient support, Meredith is doing a lot of the education with healthcare professionals, and really these in-services, whether it's the flow-on effect of COVID, making us more accessible and being able to use online Zoom programs like this, we've been able to really capture a bit more of an audience within the hospitals. And doing these Zoom in-services is one way we're trying to grow that education within the hospitals as well. So I know Meredith has done a couple, and we're going to really be promoting them further because they've been so well received. Interestingly, there was the NET 2020 preceptorship for healthcare professionals only on Wednesday night that Kate and Meredith participated in with some doctors from New South Wales and from Victoria. And there was about 200 healthcare professionals online on Wednesday night, which is fantastic, from all different specialties. And that was also some of our New Zealand friends as well. But there's always a huge interest, and we're really pleased that we do see a large uptake in the education that we provide. But we don't want to preach to the converted. We're also trying to get to those that we haven't been able to reach before. And I guess that also comes through with awareness. So awareness is absolutely key. And, we know that you as patients are the biggest advocates, and the best way to try and get this awareness out by talking about what you're going through, telling your story, especially with early diagnosis. So globally and nationally, in the lead up to World Net Cancer Day, we will be focusing our efforts on earlier diagnosis as the theme. You may have noticed that with our name change, we are now, our tagline is Champions for Early Diagnosis and a Cure. So how can we actually be champions of our own destiny, and how can we as an organisation be champions for you? So we are putting behind the scene a bit of a campaign around what this champions looks like. And we'll be really calling on you again to try and get involved in that. So we'll be presenting that over the next couple of weeks leading up to Net Cancer Day, but with the emphasis again on identifying the symptoms, asking your doctor what is neuroendocrine cancer or what is neuroendocrine tumours, and getting people to really, have it a bit more top of mind. We don't like the argument that many people have already, have said to us in the past is from a healthcare professional perspective, they've said, oh, they're so rare, we'll never see one. And we know that argument doesn't hold as much weight anymore. We know the incidence is on the rise. And we also know that in many cases, the GP that you're presenting to over and over again is not the one that actually ends up diagnosing you. So many times we have anecdotally seen, and it would be good to find out the proper data on this, but how many times you've seen the same GP, and then that one day that GP wasn't available, so you've seen somebody else in the clinic, and with fresh eyes, that's how you've been able to, they've pursued a different line of inquiry, if you like, and that's actually how the diagnosis has been found. So how can we try and get these fresh eyes on things, and not for them to always jump to the conclusion that it is the common ailment, such as irritable bowel, and such as, gastroenteritis, or some patients have really been told for many times that they were just picking up bugs, but also not also being sent to a psychiatrist. That is one of our big key areas as well. It's not in your mind, it actually is in your body, and we need the doctors to recognize that as well. So that's some of the key things that we're doing around the education, awareness. We'll be really ramping up our awareness, not just for World Neck Cancer Day, because that's just one day and it's in a cluttered, everyone has their day, their month, their everything. We want to have ongoing awareness all year round, and 24/7, to try and really drive home these messages of what to look for. So I also just thought that, in relation to some of the tests that are available, and thank you again for sharing the information around some out-of-pocket for your scanning. Again, we are working on that and trying to get an increased or an extended indication of these reimbursements for definitely for gallium PET scans, and for FDG PET. But please keep on sharing, your out-of-pocket circumstances that are happening, because it all starts to build arguments around that. But with regards to some of the other tests and diagnostic tools, obviously you guys are aware of the chromogranin A blood test, which is really used as sort of an ongoing, very few GPs would actually use that as their first point of call for a diagnostic test. I don't think they actually would even know that can diagnose patients. But it is used on monitoring and ongoing monitoring as well. And there's another, there's always things being developed. The circulating DNA is a really interesting area of research that I know that we've got centres here in Australia looking at different and trialling this at the moment. There's also an American test called the NET test, which you may have heard of. That's not something that's commonly used in Australia, but we really would like to see the evidence for this NET test. So again, it's a non-invasive blood test, and it looks at about 51 different gene types and biomarkers of neuroendocrine tumours. And it's used not only in diagnostic to detect the NETs, but also looking at in prognostics. So looking at predicting the progression of the tumours, and seeing if this particular blood test can be used to do that, as the chromogranin A may have. So the NET test may be something that supersedes that. Looking at it to monitor therapy, so seeing whether a test like the NET test could be used to see what patients would be more receptive to different treatments, such as PRRT. So there's a lot that is going on, especially in that area, and we would like to see a lot more with that. One of the what earlier diagnosis means to us is a screening test. So we know bowel cancer has that, we know breast cancer has that, cervical cancer has that. What is that screening test that neuroendocrine tumours can have, and what's one that can actually, be as effective as possible? Scans are one thing, but they are really down the line. What's something that's doesn't cost the government a lot of money, so they'll roll it out to the community, but is accurate enough to predict the tumours really, really early on, and so that we can look to try and get surgery and that sort of thing really up the up the treatment pathway. So these are some of the things that we are always looking at globally and here in Australia, and we hope that some things like this NET test, whether it's the NET test or something else being developed, because we know a lot more about the genomes and we know a lot more about how the tumours react, what sort of screening tool can be invested in, and we're really trying to encourage government to look for that. So the awareness is really key, the education is key, but the research is really key as well. And what can we actually, how can we push that forward? So a lot of all of this will be put into, again, this submission that we're working on, not only in the Senate inquiry submission, but in our framework, our neuroendocrine, national neuroendocrine cancer framework that we really want to drive forward, and earlier diagnosis is absolutely key for that. It's also key in all our advocacy work that we're doing to get an optimal care pathway, which I have mentioned prior. This is something that we are really pushing for, and it is being looked at. And these are all little pieces of the puzzle that will help to educate the healthcare professionals when seeing a patient over and over again, or we hope not over and over again, with these symptoms, and to suspect that it could be a neuroendocrine tumour. So that's some of the things that we're doing with the education, and I'm really excited about launching those GP modules, because it's pretty much the first in the world from my understanding. And I know that we will be sharing hopefully the successes of that with everybody as well. So watch this space, that will be launched very soon. One of the, and another, not a one of, gosh, it is, everything is one of. We have quite a few balls in the air at the moment. But I also wanted to spend a bit of time just towards the end now talking about a very important project we have going for our Western Australian unicorns. As you may have seen, we have launched a petition for to, amongst other things, recognise a hospital over there called Fiona Stanley Hospital as a referral hospital for neuroendocrine tumours, or what we would like to think is a centre of excellence. So the reason that came about is we are really noticing in Western Australia that we weren't seeing very coordinated care for our patients. We know that happens throughout the country, and we're constantly trying to evolve that. But we did want to focus on Western Australia because we don't necessarily have a nurse coordinators over there. We don't necessarily have the way the healthcare system works is you are very much determined what hospital you go to by the geographical area that you live in. So we really thought, how can we try and combat that? And we're grateful, so grateful to our patients in WA who have been really pushing this forward. And to Michael Doyle, our Consumer Advisory Group member in Western Australia, who's been meeting alongside our patient support facilitator, Doreen, with politicians over there. And it's exciting to see that we are getting some really good traction. Michael was only meeting with Labor MPs this week to try and get in with the Health Minister. They are definitely getting behind our petition, which we will be presenting to the Legislative Council on World Net Cancer Day. So to all our WA friends, please, unfortunately, I would love all the everyone throughout Australia to print that up and sign away, but unfortunately it can only accept WA residents. So please get online, download the printable version, and it is only real signatures, not digital signatures, and you can't photocopy, so we can't cheat. So please get as many of your family, friends, community. We know that we'll be out on the streets, I'm sure, trying to get as many of those as possible to really show that we're a force, and that this is a huge unmet need for our patients, and to try and drive that forward. It has been done in other cancers, so we just want that to be done for our patients, and it will allow us to invest more resources. Um, at Fiona Stanley Hospital, we already have our registry there, but also, funding more support services and nurse coordination as well. So please, if you're in Western Australia, look on the website, or look on, actually, it was put on the Facebook page today. Please download and get as many friends and families, because you can actually leave your house, not like us here in Victoria, as many of them to sign as possible. And again, just by doing that, you are telling the story of what a neuroendocrine cancer is, and raising awareness within your community, which has the potential to save lives, and if other people are actually going through the same thing. So I thank you to you in advance, to our WA friends, and thank you to all of you for tuning in. I hope that this is all very new, and I hope that you did get something out of it. But rest assured that earlier diagnosis is one of our key areas of concern and of ongoing concern, but of also our ongoing projects. And we look forward to talking to you about that GP program in the next couple of weeks, and getting your support behind it as well. So wishing you all a happy Friday and a very happy weekend. And to all the fathers out there, happy Father's Day for Sunday. We hope you are very, very spoiled, as you should be, and you at least get breakfast in bed. If like Victorians, you couldn't get out to a store to buy a present, breakfast in bed's always a good thing. So have a very, very happy weekend, and I look forward to seeing you next week. Thanks, everybody.